Hi everyone. I wanted to do a little extra something this week to help you guys with your understanding of medical terminology, especially this week when we're talking about things like the lymphatic system and the respiratory system. So what I've done is I made a little gameplay and something called Kahoot. And Kahoot is an online platform for gaming as well as education. And so what's going to happen is the questions and answers are going to come up on your screen here. I'll let you guys have the time to answer the questions, and then at the end I will give the correct answer. So let's go ahead and jump in and get started. All right, so I'm going to start the game here. And the first question is going to be coming up right now. I know it says number 3, it's actually number 4, so bear with me here. So number 1, what do we call swollen lymph glands? What do we call swollen lymph glands? All right, the correct answer here is going to be lymphadenopathy. Lymphadenopathy. And we say that it's that because we're talking about not just the lymph itself, but we're talking about the lymph glands. So we have to make sure we include everything. And so even though we know that itis does mean swollen, in this case we're actually switching it to that pathy. So lymphadenopathy. All right, let's do our next one. All right, the next question. What does the term CBC stand for? What does the term CBC stand for? All right, and the correct answer here is going to be a complete blood count. This is a blood work that we do to look at sort of the breakdown of your blood. So the red blood cells or erythrocytes, white blood cells or leukocytes. We also look at the platelets, which are thrombocytes. So all of these things play into what we look at for that complete blood count. All right, next question. Next question. Elevated levels of white blood cells. What is the term we use for elevated level of white blood cells? All right, and in this case, that term is going to be leukocytosis. So right away, we can take away the yellow one, that erythrocytosis, because erythro means red. So we're going to be specifically looking at just the term leuko, because leuko means white. Leukocytes is just essentially the term for white blood cells. Leukopenia means small white blood cells. So by proxy, leaving us left is leukocytosis, meaning elevated levels of white blood cells. All right, moving along, number 4. What is the term that we use for an enlarged spleen? What is the term for a spleen that was enlarged? And here that term is splenomegaly. Megaly means enlargement. Spleno is spleen. Hepatomegaly is referring to an enlargement of your hepatic, which is not spleen. Splenitis is an inflammation of the spleen, and splenectomy is a removal of your spleen. But if we were asking for enlargement, that's going to be the term megaly. Okay, number 5. To perform a surgery to remove a lymph gland, what is the term for to perform a surgery to remove a lymph gland? that term is going to be ectomy. So ectomy is surgical removal, so lymphedemectomy is the surgical removal of a lymph gland. Again, lymph by itself would just mean the lymph itself, but if we mean lymph gland, it is lymphedema, lymphedemo, but ectomy has an E, so we don't need that extra O. All right. Moving along, number 6. What do we call the procedure to visualize the lymph vessels using contrast dye? Procedure to visualize the lymph vessels using a contrast dye. All right, that is a lymphangiography. Lymphangiography. Lymph is referring to the lymph nodes, angio is the vessel, and graphy meaning visualization. So lymphangiography. Number 7. What is the term that we use for difficulty breathing? What is the term we use for difficulty breathing? All right, that term is dyspnea. Dyspnea. D-I-S means painful or difficult. Pnea is breathing. So bradypnea would be slow breathing. Eupnea is normal breathing. Apnea is without breathing. So then dyspnea is painful or difficulty breathing. Number 8. What do we call an increased respiration rate? What is the term for an increased respiration rate? The correct answer here is going to be tachypnea. Tachy means fast or increased. Again, pnea means breathing. Cyopenia means you're turning blue with your breathing. We just talked about how dyspnea is difficulty or painful breathing, and then sinusitis is an inflammation of the sinus cavity. All right, number 9. What term do we use for a wheeze sound, hoarse voice, and runny nose? What term do we use for a wheezing sound, hoarse voice, and a runny nose? All right, here that term is going to be rhinorrhea. Rhinorrhea. Rhinoplasty is the surgical repair of a nose, so rhino means nose. Rhinoectomy is the removal of a nose. Rhinosis is the condition of the nose, but if we're talking about a runny nose, a hoarse voice, and a wheezing sound, that is going to be rhinorrhea. Number 10. What medical term do we use to mean decrease in oxygen in the arterial blood? Decrease in oxygen in the arterial blood. Right, that term here is going to be hypoxia. Hypoxia, hypo means decrease or lower than, and then xemia is talking about the oxygen level in the arterial blood. So hypoxemia is the decrease in the arterial blood. Number 11. What term means slight blue coloring to the skin? What term means slight blue coloring to the skin? That term is, ironically enough, on the blue, cyanosis. Cyanosis. Cyan is the color blue. and osis is condition of, so cyanosis. Number 12. What medical term do we use to mean listening to the lungs with a stethoscope? Listening to the lungs with a stethoscope. That term is osculation. Osculo is referring to the auditory, which is hearing. So you're using a stethoscope, it is osculation. Number 13. What does the term COPD stand for? What does the term COPD stand for? Oh, I'm so sorry. Lost my train of thought there. COPD stands for chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease. Number 14. What is the medical term for the visualization inspection of the bronchi with a scope? What is the medical term for visualization inspection of the bronchi with a scope? That medical term is bronchioscopy. Bronchioscopy. So bronchi or broncho is the bronchi that we're looking at. Scopy means visualization with a scope. And the last question here. What is the medical term used for preventing or relieving a cough? Which of these words? Bronchodilator, antitussive, decongestant, or corticosteroid? Which one means to prevent or relieve a cough? Prevent or relieve a cough. That term is antitussive. So it's a type of medication that is given to help with relieving or preventing a cough. Hopefully you found this little gameplay helpful for you guys. I'm going to do this for the last remaining weeks to help you guys with putting those terms into use. Have a great week, everyone. Bye now.